So we know that people with brain cancer experience a lot of symptoms due to the treatment and to the cancer, and they also experience a lot of unmet needs, whether they're psychological, informational needs, practical needs. And so what we're doing as part of the BRAINS program is we're implementing screening to identify unmet needs in people with brain cancer. And so we're doing this using an online portal, and we're implementing the 9-item supportive care needs survey. And so this study, we are wanting to assess the acceptability of the 9-item supportive care needs survey in people with brain cancer. And so what we've done is, in order to get a range of different perspectives on the tool, we've recruited people with brain cancer, caregivers of people with brain cancer, and healthcare professionals who provide support to people with brain cancer. And so we had them look at the screening items and give us their feedback in terms of the wording of the items, how relevant they are, how easy or difficult it is to understand them. And we analysed the interviews using an interpretive description approach. And so we ended up recruiting 14 patients with brain cancer, 4 caregivers and 7 healthcare professionals. And so when we asked participants to comment on the instructions of the supportive care needs survey, most participants said that the instructions need to be worded in simple language and to be made more concise, especially for people with reading and comprehension difficulties due to the brain tumour. Participants also commented on the items of the supportive care needs survey. And out of the 9 items, only 1 item participants found to be acceptable, and they didn't recommend that we make any changes to that item. But for 8 of the 9 other items, participants made a range of different suggestions. So as an example, the item fears about the cancer spreading, participants said that this item needs to be made more specific to people with brain cancer. So for example, brain cancers don't spread, but they can become worse over time. And so we've reworded this item so that it now reads, fears about the cancer progressing. Other suggestions participants made was modifying the language to be made more sensitive. And an example of that is the item, changes in sexual relationships. So while most participants said that they'd be comfortable answering this question, they did say that not all participants will feel comfortable because it's such a sensitive and personal topic. And so we've reworded this item so that it now reads, changes in your relationships more generally. Another piece of feedback that participants provided us is that we need to simplify some of the language used in these items. So as an example of this, being informed about your test results as soon as feasible. Most participants told us that the word feasible is not really a word that most people use in everyday life. So an alternative to feasible is to change it to as soon as possible. And so we also asked participants to comment on the response options. So as you can see here, these are the original response options used in the supportive care needs tool. And participants told us that these response options were actually quite difficult to understand and to use when they're trying to respond to the screening items. And so what we did was we looked at the response options used in the Indigenous version of this tool. And this tool, the response options you can see here. So as an example, high need in the original screening tool has been modified to need a lot more help. And so when we gave the participants the option between these 2 response options, all participants preferred the wording used in the Indigenous version of the tool because they said it sounded less clinical and a lot kinder. And so based on the findings of our study, it's very clear that modifications need to be made to the instructions of the supportive care needs tool, the screening items and the response options. And if we're talking about patient-centred care, we often refer to using patient-reported outcomes to capture patient needs and distress. But if those screening tools are worded in a way that make it difficult for patients to understand and to use, it's kind of missing the mark when we talk about patient-centred care.